Hello, dear students. Welcome back to your science classes. How are you all? I hope you all are healthy and doing well. So, students, I'm your science educator again here with a new chapter and a new concept. And today we have chapter number 12, which is about first aid. So, first aid means the procedures, the steps you have to perform when you see somebody in danger or in any kind of wound it's present there. So now what are the learning objectives we have? The basic aims of the first aid, the rules of the first aid kit, what are the things we have to manage in our first aid kit, some ways to deal with certain emergencies and cuts and wounds, burns and scalds, nosebleed, poisoning and fractures. So these are the learning objectives we have. So let's get started this chapter. First aid is the initial care given an illness or injury. It is usually given by a lay person to a sick or injured person until medical treatment can be assessed. First aid means the first help is given by you to a patient without in the presence of any medical treatment or medical supervisor. Okay. Many deaths and impact of injuries can be prevented with the first aid if casualties are treated immediately. Most of this timely care prior to the arrival of the doctor or medical help means the difference between life and death. So when we have in emergency, so a single minute, a single second is plays a very important role. So rather than waiting for medical practitioner or medical equipments, if we know how we have to do the first aid, it will help us to protect to save somebody health. Now the basic aims of the first aid we have to save life, to protect the casualty from getting worse, to reduce pain and priorities of casualty treatments. The rules of the first aid we have: stay calm, don't be in rush, your surroundings should be safe, do not put yourself or the other injured or casualty at risk. So you have to calm yourself and you have to make your surroundings that way that you are also protected and that injured person is also safe. Decide if the casualty needs some medical aid. Ask for advice if you are not sure. Always make sure you know that you know first aid, but before that, you also have to consider that it is good for the injured person or not. If you have any doubt, so you have to take advice from anyone. Now reassure the injured and keep him warm. Keep the injured comfortable and do not move with him or her if there is suspicion of injury to back or neck. Wash your hands before applying first aid and dressing. Wear disposal gloves to prevent infection. Clean wounds thoroughly before applying dressing. Wash away foreign objects such as grit or glass. Don't remove embedded objects. Leave that to medical experts. Always use the right dressing for the injury. Do not forget to replace any item for use from your first aid kit. Look for the following: is there failure of breathing, is there severe bleeding, is there shock, light or severe. So what you have to do here, you have to keep yourself calm and always you have to make sure that you know what are the first aid things you have to perform on different situations, and you have to make sure that also you have your first aid kit should be have all equipments which you needed. Okay, so next, first aid kit. So after this, attend to these and then treat easily observable injuries. Clear the crowd with polite words. Do not allow people to crowd about the casualty. Do not try to do not too much. Do not try to do. You just have to do the first aid. Don't try to do much. Don't become a doctor at that time. You just need to do the basic things which help him to protect her or his life. So you are only a first aider. Give only that much assistance as to see that the condition does not become worse and life can be saved. So now we are going to discuss about the first aid kit. A well-stocked first aid kit kept within easy reach is a necessity in every home. Having supplies gathered ahead of time will help you handle an emergency at moment's notice. You should keep one first aid kit in your home and one in the car. Also be sure take a first aid kit on your family vacation. Choose containers for your kids that are roomy, durable, easy to carry, and simply to open. Include the following things in each of your includes following in each of your first aid kit. So what you have to make sure that what you have to keep in your mind that always you have to take first aid kit in your home as well as in your car. And ever you move, you do any home family vacation, you are going on vacations with your family, so at that time also you have to keep your first aid kit with yourself. And these are the things we have to keep inside our first aid kit. The first aid manual, style gauze, adhesive tape, adhesive bandage in several sizes, elastic bandages, antiseptic wipes, soap, antibiotic cream, and triple antibiotic ointment, antiseptic solution, hydrocortisone cream 1%, tweezers, sharp scissors, safety pins, disposal instant cold packs, calamine lotion, alcohol wipes, thermometer, plastic gloves, at least 2 pairs, okay? And flashlights, list of emergency phone numbers. So these are the things you have to keep in your first aid, okay? Then your kit will become your first aid kit. Otherwise, not if you don't have these equipments, these things in your first aid kit. Some ways to deal with certain emergencies. So if you have minor cuts and wounds, to wash the affected area thoroughly with soap and water. Remove any foreign material such as graves or dirt that can cause infection. Cover the wound with a sterile dressing and bandage and keep it clean and dry at all times. Wash the wounded area daily and reapply a clean dressing until it is completely healed. So what you have to do if you have a cut, so first of all, you have to make sure that you have to wash it with water thoroughly or with the help of soap, and try to make sure that you have to remove the foreign particles upon that. And after this, you have to take your clean dressing and wrap it, and make sure that your wound should be dry and clean, and you have to repeat this process daily until and unless your wound is completely healed. Next, the punctured wounds. So punctured wounds are usually caused by sharp pointed objects. Nail or needle puncture wounds can be serious. Puncture wounds are difficult to clean if signs of infection manifest: redness, swelling, persistent pain, pumps, or fever. Contact a health professional. So whenever you have punctured wounds, so don't try to do first aid first. Make sure that you have to visit to your nearest doctor and take help from them. Now we have major wounds. For severe bleeding, apply constant pressure to the wounds with a sterile dressing if available. If there are the foreign objects in the wound such as glass, nail, or piece of stone, do not press it directly but apply pressure along the wound area. If broken in bones or dislocations are suspected, to do not move the affected limb. Embolize by a splint if possible. If you are sure there are no breaks, you can gently elevate and support the part of keeping pressure on this. This action would minimize bleeding. Dress the wound with sterile non-sticking material as soon as possible and obtain medical help. So why we are learning this chapter and why we learning this kind of problems in detail? Just because of that, if you have any kind of problem in future, so these are the things you have to keep in your mind and you have to apply it. So if the problem it's not getting worsen for you, okay, worse for you. So if you have such kind of problems, so always make sure that you have, first of all, you have to get a hint about that it is my bones is broken or not. If you feel it your bone is broken, so you have to make sure that you have to take a support from anything with the help of your other hand, and make sure that do not apply any movement on it, and make sure that you have to dress the wound with sterile and non-sticking material as soon as possible you can. Now try to remember, for large open wounds, contact a medical professional immediately. Surgical sutures may be required to do close wounds. Check frequently for signs of infection. Keep first aid supplies well stocked in your home. So first of all, what you have to do, if you find that, oh my God, it is a big problem for you, to don't to become a doctor itself by using only first aid. Just use first aid for your to prevent your situation to get worsen, and after that, make sure that you have to visit your nearest doctor and take help from them. Now we have burns and scandals. So burns are caused by heat, corrosive substance, and friction. Scales are caused by wet heat, hot liquids, and weapons and vapors. So there are number of factors to consider when assessing the severity of a burn and the method of treatment, including the cause of the burn. So whether the airway is involved, the depth of the burn, and its extent. So burn is always dependent upon the situation. It could be from the heat, from the vapor, or from the schedule. So superficial burns, these involve only the outer layer of the skin and are characterized by redness, swelling, and tenderness. These kind of symptoms you may see when you have any superficial burns. Typical examples are mites, sunburn, or a scald produced by a splash of hot tea or coffee. Such burns usually heal well if we prompt first aid is given and do not require medical treatment unless extensive. If we have severe burns, what we have to do, the priority is to cool the burnt part. The longer the burning part goes unchecked, the more severely the person will be injured. So all severe burns carry the danger of shock. So do not overcool the casualty. This may dangerously lower the body temperature. So make sure that you don't have to put a bug of ice on him to make it cool. You just have to take a small amount of ice and pour it on the area of the injured area, and make sure that you don't have to overcool that casualty. Do not remove anything sticking to the burn. This may cause further damage and infection. So you have to just cool it down. You don't have to remove anything, the skin, anything. Okay. Do not touch or interfere with the injured area. Do not break the blisters. Do not apply lotions. Blister means after some, when we get burned, so our round skin is open up with a liquid. So you always make sure that you don't have to burst that blisters. It will cause a problem for you. So do not apply lotions, ointments, or fat to the injury. Lay the hurt person, protecting the burn area from contact with ground if possible. Douse the burn with copious amounts of cool liquid. Through cooling may take 10 minutes or more, but this must not delay the casualty transmission to hospital. So just make sure that you have to do all these things in a hurry, but in a appropriate hurry. Don't do in rush, so it will hurt the casualty. And make sure that you have to take your casualty to the doctor as soon as possible. While cooling burns, check airways, breathing, and pulse, and be prepared to resuscitate. Gently remove any rings, watches, belts, shoes, or smoldering clothing from the injured area before it starts to swell. Carefully remove any clothes sticking to the burn. Cover the injury with a sterile burn sheet to protect from infection. A clean plastic bag or kitchen film may be used. Ensure that the emergency service is on its way. So I hope so, students, you understood what you have to do when you have a serious burn. Minor burns and scalds. So minor burns and scalds are usually the result of domestic accidents from first aid. So this is the things we happen with us accidentally while we make food, etc., and we use any kind of gas or. So from first aid, we generally enable them to heal naturally and well, but the advice of a medical practitioner should be sought if there is doubt as to the severity of the injury. So do not use adhesive dressing, do not break blisters or interfere with the injured area, do not apply lotions, ointments, creams, or fat to the injured area, cool the injured part. The same process you have to do, but just have to make sure that it is on a small scale. And if you find out it is getting worsened for you, so you have to consult a doctor. If clothes catch fire, they can spread very quickly, engulfing the victim in flames. Certain types of clothing, especially synthetic fabrics, may melt and stick to the skin. So the best way to reduce injury from the flames is to extinguish the fire as quickly as possible. So you have to extinguish the fire as quickly as possible with the help of anything, the extinguisher we have, or any with the help of blanket, with the help of soil. So do not run or wave your arms. Movement will fan the flames and cause the burns to be more severe. So you just have to make sure that you don't have to take movement. Okay. Lay on the ground quickly and cover your face with your hands. So you have to cover your face with your hands and you have to rub yourself on the ground. Try to smother the flames by rolling over and over. Pay attention to what's burning and focus on putting out the flame from that area of your body. So you have to concentrate what part of my body is burning more, and you have to give a concentration there. Use water or fire extinguisher to put out the fire if one is available. Next, we have nosebleed. Nose bleeding is common, especially during summers. So do make the patient sit down with head forward. So what you have to do, you have to sit down calmly and you have to take your head upward direction. Pinch the nose just below the bridge of for about 10 minutes, and ask the patient to breathe through his mouth and avoid speaking, swallowing, and coughing. Cold compression may be applied by placing ice packs over the nose area. If bleeding does not stop, repeat this nose pinching for another 10 minutes. If bleeding still does not stop, seek immediate medical care. If bleeding stop, ask the patient to avoid blowing the nose. So what you have to do, first of all, you have to make sure that the patient should be sit calmly. After that, you have to pinch the nose and take their take their mouth in upward, take their head in upward direction, and you can also use ice to cool, for cool steam, and then you have to make sure that it is stopping or not. If it's not stopping, so you have to repeat the same process. After the problem is still there, so what you have to do, then you have to visit your nearest doctor. Don'ts, what you have to don't do: do not make the patient exert physically, do not insert any object medication in the nose. Just make sure that you don't have to put anything inside their nose, and do not blow the nose. Do not make the patient speak, swallow, or cough. Next, we have poisoning. So, poisoning may be caused by swelling, breathing in, or otherwise being exposed to a poisonous substance. Symptoms of poisoning may take time to develop. However, if poisoning is suspected, do not wait for symptoms to develop before getting medical help. So, what you have to do, you if you get a hint about poisoning, so you have to visit as soon as possible to your nearest doctor. Now, common causes of poisoning includes medicine overdose, household detergent, carbon monoxide gas for furnaces, gas engines, household plants, paints, illicit drugs or overdose, cosmetics, and food poisonings. These are the things which result into poisoning. Symptoms of poisoning vary according to the poison, but may include the common uh, symptoms. We have abdominal pain, bluish lips, chest pain, confusion, cough, diarrhea, difficulty in breathing, dizziness, fever, headache, and heart palpitation. So these are the symptoms we have. How can you do your first aid for poisoning? By swelling. So check the victim's airway, breathing, and circulation. If necessary, being rescue breathing. If possible, identify the poison, which kind of poison is taken by the patient. Induce vomiting only if the poison control center tells you to do so. So if the poisoning center told you that you have to make sure that the victim should be get vomiting, so then you have to induce it, otherwise not. If the victim vomits, protect the airway. If the victim starts having convulsions, protect him her from injury and give first aid for convulsion. Reassure the victims and make him her comfortable first. Okay. Now first aid for inhalation of poison. So call for emergency first. Never attempt to rescue a victim without notifying others first. Hold a wet cloth over your nose and mouth. Open the windows and doors to remove fumes or smoke. Take several deep breaths of fresh air, then hold your breath as you go in. Avoid lighting a match as some gases may ignite. It could be get fiery. So after rescuing the victim from danger, check his or her airways, breathing, and circulation. If necessary, perform rescue breathing. As needed, as perform first aid for skin burns, eye injuries, or convulsion. If the victim's vomits, protects his or her airway. Even if the victim seems perfectly fine, get medical help. So if you find the casualty is fine, then you also have to take medical help. Now what you have to do not give any unconscious next victim anything by mouth. Do not induce vomiting unless you are told to do so by the doctor. So what you have to do, you don't need to go over smart at that moment. Okay, just make sure that you have to do only those things which is needed for to save her life or his life. That's it. After that, you have to take a consultation to the doctor, or you have to visit to the nearest doctor as soon as possible. Okay. Next, if we have fracture, a fracture consists of a break or crack in the bone. There are two types of fracture: simple fracture and compound fracture. In simple fracture, the skin intact and no wound is present anywhere. Okay. But in compact fracture, the underlying skin is broken or damaged. This type of injury may result in the bone protruding through the victim's skin, so the bone itself may or may not be visible in the wounded area. So it is not always possible to tell with the naked eye if a bone has been fractured. Here are a few signs and symptoms which just show a person has suffered a fracture or not. So we cannot say by our naked eye okay, it is fracture or not. So there are some symptoms we have to see. If these are here, then it means there is a fracture. Deformity, open a wound which may indicate an underlying fracture. Severe pain at the spot of fracture. Tenderness, pain on gentle pressure. If you apply a simple pressure and the casualty say, oh, I have a pain, a big good pain, so it means this is your tenderness. And after see this, do not press hard. So swelling of the area and discoloration, loss of normal movement of that part, and irregularity of the bone. So these are the symptoms which can help us to determine it is a fracture or not. Now first aid for a fracture. The through a fracture are really life threatening, it is recommended to check and monitor the victim's airways, breathing, and circulation, and to check the disabilities using first aid and training skills. Treat the victims for shock if necessary. Treat the fractures on the spot so that the fractured ends are brought to the original position and the victim is ready for transport. Handle very gently. Avoid all necessary movements because it is a fracture. Okay, and do not handle the fracture unnecessarily. The simple the first aid, the better it is. After this, apply a splint to give support to the broken. So you have to provide a support to the broken hand or broken leg or anywhere your fracture it is. It will help us, or you can give a pillow around the injured bone as splint. This will prevent further dislocation of the broken bone. So students, this is the end of your chapter. I hope so you understood it very well and you like this chapter as well. Now I'm going to meet you in your next class. Till that, bye bye. Have a good day.